Good day everyone. This is Teacher Nell. Today the finish line is near to come. Since it is the fourth quarter of the lesson, our topic for today is about non-communicable disease. Our most essential learning competencies is to explain non-communicable disease based on the cause and effect, signs and symptoms, risk factors and protective factors, and possible complications. And now, we are going to discuss what is non-communicable disease. Non-communicable disease, or the NCDs, are non-infectious illnesses acquired through hereditary or lifestyle factors. Non-communicable diseases are diseases that are not spread through infection or through other people, but are typically caused by unhealthy behaviors. So the term NCDs refers to a group of conditions that are not mainly caused by an acute infection, result in the long-term health consequences, and often create a need for long-term treatment and care. And now, let's proceed to the common non-communicable diseases. These are allergy, asthma, cardiovascular disease, cancer, diabetes, arthritis, and renal failure. These are just the common non-communicable diseases. There are many other non-communicable diseases that we have seen or we have observed. This quarter, we will discuss these diseases one by one. The first one is allergy. Allergy is the extreme response of our body to an antibody-forming substance or antigen. It is triggered by eating food with allergens, getting vaccine or medicines that you have allergic reaction to. It can also caused by insect stings or inhaling dust or other particles. The signs or the effect of allergies include redness, and itching of skin, swelling, impaired sight or hearing, headache, numbness, difficult in breathing. Allergies can be acquired depending on your genes, sex, race, and age. If not addressed immediately, allergies may cause blockage of airways or veins that may cause death. And now, how to prevent allergies? To prevent allergies reactions, we need to know what triggers your allergy and avoid them. Always have anti-allergy medicines. Check the ingredients of the food if there are possible allergens. And now, let's proceed to asthma. Did you know what is asthma? Asthma is a condition where breathing becomes very difficult. It can be triggered by dust, mold, pollen, weather change, cold air, hormonal change, infections, stress, and certain foods. What will be the effect of asthma? People with asthma experience difficulty in breathing, fatigue, chest pain, and wheezing sound when inhaling. Asthma can be acquired through heredity, vices, weight, exposure to smoke or fumes. When not addressed properly, people with asthma may experience shortness of breathing that may lead to extreme chest pain, passing out, and even death. How to prevent asthma? Asthmatic people shall avoid inhaling strong smell substance. They should also drink 6 to 8 glasses of water a day. Stress can also be a trigger, so avoid stressful situations. Also, asthmatic people shall not expose themselves to very cold environment. And now, let's proceed to cardiovascular disease. What is cardiovascular disease? Cardiovascular disease are leading cause of death in the Philippines. This disease include coronary heart disease, heart attack, rheumatic fever, congestive heart failure, and stroke. We will discussing each cardiovascular disease, so you much better watch out and listen carefully. Now let's discuss coronary heart disease. Coronary heart disease are caused by blocked or narrow arteries. It is a type of heart disease where the arteries of heart cannot deliver enough oxygen-rich blood to the heart.
When a heart attack happens, it's because a blood clot blocks the heart's blood supply. This usually occurs due to a condition called coronary artery disease, CAD, where arteries get clogged over time. The heart muscles start dying within minutes because they don't get enough oxygen. KD can silently develop for years without causing symptoms. When a blockage occurs, it's a serious threat. The clot is made up of tiny blood particles and fibrin strands. Thrombin, activated by factor 10A and prothrombin, plays a crucial role in clot formation. It makes the clot bigger and stickier, especially on the plaque inside the arteries.
Next is heart attack. Heart attack occurs when the heart muscles stop functioning due to lack of blood flowing to it.
A healthy heart is a big, strong muscle. Its job is to pump blood throughout the body. Coronary arteries help the heart by supplying it with oxygen-rich blood. But over time, cholesterol and fats can build up in our arteries. This buildup is called plaque. If plaque breaks open, a blood clot can form. And if that clot blocks the artery, your heart won't get enough blood and oxygen, which means that cells in your heart muscle may die. When that happens, it's called a heart attack. There are other less common reasons that oxygen-rich blood might be blocked. For example, a spasm or a tear in the artery can block blood flow. Now, a heart attack doesn't have to be deadly. Quick treatment can get the blood flowing to the heart, reduce the damage to the heart, and save a life.
Then, rheumatic fever. Rheumatic fever or rheumatic heart disease, it caused by the immune system attacking the heart and by causing fever and damage.
Rheumatic fever.
What is acute rheumatic fever? Acute rheumatic fever is an illness caused by a germ called Streptococcus or Strep A, which causes sore throats and skin sores. It can be passed between people by touching, coughing, and sneezing. In some people, if sore throats and skin sores are not treated early with antibiotics, an illness called rheumatic fever develops. Rheumatic fever can cause painful, swollen joints, fever, uncontrolled jerky movements, and inflammation or swelling of the heart. There is no single test that can be done to diagnose rheumatic fever, But it is very important to get diagnosed quickly at the local health service or hospital because it can have long-lasting effects on the heart.
And congestive heart failure, or the CHF. It is a complex clinical syndrome characterized by inefficient myocardial performance, resulting in compressed blood supply to the body.
Okay everyone, let's talk about heart failure and how it affects the left and right sides of the heart. We'll start with left-sided heart failure because it's a little more common, and a lot of times it's caused by CAD, or coronary artery disease. When the left ventricle ejects blood out to the rest of the body, it also feeds itself through these big, wide coronary arteries. But over the years, through smoking or unhealthy lifestyles, you can develop plaque and cholesterol in these arteries, making the diameter a lot smaller. So you're now telling this same ventricle that used to push blood through this big, wide open hole through a much smaller hole. You're increasing the pressure and tension on the left ventricle, so it has to beat harder, increasing your blood pressure and sometimes increasing your heart rate to compensate for it. When you do that, the blood's not going forward as well as it used to. So the ventricle can start to stretch because more and more blood is filling up in that left ventricle and it can become dilated. Now when the left ventricle becomes dilated, it starts to push back on the mitral valve, and you can start to have mitral valve prolapse and mitral valve regurg, where the blood is actually getting back into the left atrium. Now the left atrium's getting more blood. So what does it start to do? It starts to dilate as well and pushes blood back even farther. Well, what's behind the left side of the heart? The lungs. So when you listen to these patients in left-sided heart failure, they start to have pulmonary congestion and they start to have these crackling and wet lung sounds. And it's because blood is backing up into them. Well, what happens when you have left-sided heart failure? It then begins to lead to right-sided heart failure. Not always, and sometimes you can have a myocardial infarction on the right side and that can lead to it. But now that blood is getting backed up even further, what happens to that right ventricle eventually? It starts to dilate as well because it's having a hard time pushing blood out to the lungs, which then causes issue with your tricuspid valve and then back into the right atrium. But now what happens before the right atrium? You have your peripheral venous system. So all this blood's getting backed up into your periphery system, so you have high venous pressures and you have pitting edema because all that blood's traveling to the legs and fluids building up in the legs rather than being pushed out through the rest of the heart, out to the rest of the body, which also can lead to distended jugular veins. So you start to see your veins start to bulge and get bigger because all of that fluid is backing up. And that in a very basic way is how heart failure is affected.
And the last one is stroke. It goes by the blood vessels in the brain being broken or blocked. It is called also a brain attack.
Stroke. Stroke is a brain attack which causes your body to become paralyzed. It is a very common problem throughout the world. Every 1 in 6 man and every 1 in 5 woman is at risk for developing stroke. It is the second highest cause of death and highest cause of disability in the world. What happens in a stroke? In about 80% of cases, stroke is due to blockage of blood vessel and brain due to blood clot. In 20% of cases, stroke is due to rupture of blood vessel and brain. In both cases, parts of affected brain suddenly stop working. What causes stroke? There are many causes. Most important cause is high blood pressure, especially long-standing and uncontrolled high blood pressure. Diabetes, high cholesterol, and heart diseases are also an important risk factor. Another important risk factor is tobacco in the form of cigarette, shisha, or even chewing tobacco. These factors, over a period of time, affect blood vessels of brain, ending up in either blockage or rupture of them. How do we identify stroke? Acronym for stroke symptoms is known as FAST. F stands for paralysis or drooping face. A is for weakness of arms or legs. S represents slurring of speech and inability to speak. If anyone develops one or more of these symptoms suddenly, they probably had a stroke. T stands for time, means you have to rush to emergency because in stroke, time is brain. If you lose time, you are going to lose brain. What to do if someone has a stroke? Take patient to emergency room as soon as possible. An urgent CT scan is needed to find out if it is due to a blood clot or rupture of blood vessel or brain hemorrhage. If it is due to a blood clot, patient may benefit from a clot-busting drug called TPA. This Meditor can only be given with 4 to 5 hours. Patient needs to be admitted in hospital, preferably in a stroke care unit. Blood pressure control and prevention of complications like pneumonia are mandatory. Long-term care. Stroke patients require a long time to recover, usually months, and have a chance of recurrence of stroke. Long-term care requires daily medications prescribed by doctors, abstinence from smoking or tobacco, rehabilitation, and regular exercise. Some patients may require surgery of brain or blood vessel. Take-home message. Stroke is preventable if risk factors are controlled, especially high blood pressure. Stroke is treatable. Most people can go back to work with the correct treatment.
So these are the cardiovascular disease. What will be the risk factor of cardiovascular disease? Cardiovascular disease may acquired through heredity, age, obesity, lifestyle, physical inactivity, or the other disease. And now listen up, students. How to prevent cardiovascular disease? So, to prevent cardiovascular disease, we need to keep your heart healthy. Remember to choose a healthy, friendly diet. Monitor your cholesterol level or the blood pressure. Maintain your normal body weight. Do physical activities and avoid vices. Let us proceed now to cancer. What is cancer? Cancer is caused by abnormal or uncontrolled division of cells. Remember, look for the caution signs and symptoms. The caution stands for C, stands for change in bowel movement. A wound that does not heal. U, unusual discharge. T, thickening of lump somewhere. I, indigestion. O, obvious change in a wart or mole. And nagging cough. So early detection of cancer is the key to getting treatment right away.
Prevention steps of cancer: have a regular checkup, avoid vices, avoid too much exposure to sun, eat fruits and vegetables, consume meat, and regularly exercise.
And now let's proceed to diabetes. Diabetes is a disease in which the body has too much sugar in the bloodstream, leading to complications. Now, what will be the symptoms of diabetes? These are the symptoms of diabetes. First, always thirsty and hungry, frequent urination, sudden weight loss, fatigue, irritability, blurred vision, and slow healing wounds or sores. The risk factor of diabetes include family history, geography, weight, inactivity, present condition, race, age, blood pressure. The people suffering from diabetes may experience blindness, organ failure, and permanent wounds. And now, how to prevent diabetes? To prevent diabetes, we need to monitor your blood sugar level, to regular checkup, include grains and fiber in your diet, maintain the healthy weight, and choose healthy foods. Arthritis can be acquired depending on your genes, sex, race, age, and your food choice. It is worse. Arthritis may cause osteoporosis, cardinal tunnel syndrome, heart and lung problems, and may even cause death. To avoid having arthritis, you have to be physically active, know what triggers or causes arthritis, and avoid them. When experiencing pain in the joints, immediately consult a doctor. Lastly is the renal failure, also known as a kidney failure. It is a disease in which the kidney or the kidneys stop functioning normally. The renal failure is caused by the toxin developing in the body. The symptoms may include anemia, fatigue, lack of energy, lack of sleep, and ill feeling. And now, how to prevent the renal failure. So these are the prevention steps of renal failure. These are: manage your blood sugar level, quiet smoking or drinking alcohol, eating healthy, be physically active, drink enough of water. So that's all the prevention steps of the renal failure. So that's all the non-communicable disease that we discussed in this today, and I hope that you learned a lot in this lesson.